In California, they actually lose more than half. If you start thinking about, if you have a
Most, if not all, of America's top media business networks often turn to financial advisor Ed Butowski for his advice and perspectives. So when Ed knew something was wrong inside of his body, he turned to Texas Health Center for Diagnostics and Surgery.
I was having periods where I couldn't really move, I couldn't think, I couldn't do anything, I couldn't really talk.
By turning to Texas Health Center for Diagnostics and Surgery, Ed chose an MRI twice as powerful as many other units across the country.
Twice the strength allows us either to do the same type of imaging we did before in half the amount of time, or it allows us to do twice the resolution in the same amount of time, kind of like almost like a high definition MRI, if you will.
Ed hated going into old-style MRI machines that caused him to feel claustrophobic and even sick to his stomach.
Now with the new MRI, it is significantly better. It isn't as restricting as it was, and it makes for a much better experience. I mean, you're going to have to get them done. All right? I mean, there's no question about it. But now you don't have to take pills and relax and start drugging yourself before you get this test. It's really much better, and the quality is significantly better.
There are patients that feel uncomfortable kind of being enclosed in that type of tight space, and so this larger opening allows not only more comfort, but I think also offers less anxiety for a lot of people.
The state-of-the-art scan at the hospital did detect a benign tumor in Ed's brain, but he and his doctors are monitoring it carefully with regular MRI scans instead of immediately choosing surgery.
There are a significant number of patients who have serial examinations, and just for the purpose of determining whether the abnormalities that they have are stable or not. These might be people who have cancer or people who have a chronic illness who are undergoing some type of therapy, and these serial exams can either tell whether the therapy is working or whether or not they need to undergo additional types of therapy.
Ed admits undergoing the MRI still isn't his favorite thing to do, but given the alternative, he thinks it's a blessing.
I'm always on the go. I mean, I do a lot of things, and I don't have time to really stop. All right? To stop and have surgery, and if I had made that decision before to have surgery, a lot of things that I've been able to accomplish in the last year would not have been accomplished. So being able to use this machine has made my life better, has made me relax more, and has allowed me to have better clarity, which also has allowed me to relax more.